Welcome to the Expert Edge. This is the show where we bring on experts in their fields of health and wellness practice, and we hear their stories and learn what they see working in the field of diabetes reversal and prevention. So I'm really happy to introduce today's expert, Julie Kaanapu. Welcome, Julie.
Thank you. So excited to be here. Appreciate it.
Julie is a national board certified health and wellness coach with over 25 years of experience in the health industry, working in physical therapy, implementing medication management protocols, coaching clients to achieve their health goals, and assisting physicians with training and certification programs to improve patient outcomes and reduce their risk of disease. So, as an educational background, she has two bachelor's degrees, one in sports medicine and one in biology, both from the University of Oregon. And she is certified in functional nutrition and has done a lot of work in looking at health from a holistic standpoint, also working in the field of hormone balancing. She's a speaker and a lifestyle medicine practitioner. So we are so happy that she is bringing that wealth of expertise to us today. I'm just so happy to have you here, Julie.
I'm so excited. Yes, thank you so much.
So I'd like to hear from you. How did you get started with your interest in health and lifestyle? Like, were you born with it, or did something happen that kind of brought you to it?
Right? I don't know. And I definitely wasn't born with it. I always did have an interest in like anatomy and all that type of thing. But when I found the area that I just was so passionate about was when I started to age as well and realized going to the doctor was not that rewarding as I expected it to be. You know, I was told in my 40s that I wasn't a spring chicken anymore, right? That my vitamin D was normal, but kind of low, and let's just watch it. I was like, watch it? What? Get worse? When I started working in physical therapy and medication management and pain physicians, I was asked about what others were doing about hormones. And the answer was, I don't know. What are you doing? You know, to these doctors, and realizing it was all the same, that they didn't know. And pretty much across the board, working with 7,000 providers across the country, none of them in conventional medicine, naturopathic medicine, are taught how to optimize hormones. And seeing how a lot of women were treated or are treated, the differences between FDA approved certain things with men versus women. Women get the shaft. And I started finding a company that was teaching and certifying physicians on this preventative medicine and hormone optimization. And I thought it was so intriguing. So I've been teaching and speaking for them for about 11 years, and found one common denominator, though, too, when working with doctors. Even the best of them that have taken the extra time and understand the evidence-based medicine and literature that anybody can research and find, they all didn't have one thing, and that was more time, right? So when a patient comes in, we're all patients. We go in to see the doctor. We're taught to trust our physicians, right? Our doctors, and especially women that have more than one doctor, right? Go to one and might hear one thing, that this is safe, this is beneficial. And then they go to another doctor that they still like, know, and trust, that says it's not, and you should stop this, or it's not beneficial, right? It's harmful. So then most people are left in this, you know, damned if I do, damned if I don't situation. And which leaves most people doing nothing. And in literature, when it comes to specific hormones and that type of thing, a National Cancer Institute showed that doing nothing was more harmful than if you're doing something. And my mom went decades without hormones, if we're being specific on that end, and she has dementia, and she lives in memory care. My dad was diagnosed with cancer, and he passed away about 1.5 years ago. And he was diagnosed, and she was moving into memory care within 2 months of each other. And learning what I know now, if I could have optimized their hormones, if I could have given them specific ways to metabolize and detoxify and balance their blood sugar and doing certain things, that Alzheimer's is known as type 3 diabetes, right? If I could have done that earlier and got there sooner, would they have a different outcome? And of course, I'll never know. But I want others to know, right? So it's maybe not too late for them. And that's why I became so passionate, is to empower women, specifically men too, but to empower them to understand that they have a choice, that it is their actual responsibility. They get to choose
Mhm.
which physicians they work with. They get to choose together what's going to be right for them. And it should be individualized and precise for whatever their health goals are.
Mm. I love that. And I think that's so interesting. It's an angle around diabetes and prediabetes and metabolic syndrome that we don't always hear as much about as we might hear about, exercise and diet. So
Yes.
I'd love to hear from you. Tell us more about how are hormones related to diabetes?
Huge. My goodness. So, what are hormones, right? Hormones are chemical messengers. And these chemical messengers actually tell certain cells and organs what to do. So, if you think about it, if you lose that, your body's just in havoc. And specifically women, right? We don't do well on hormone roller coasters. Ask anyone with bad PMS who's been through a pregnancy, or a man who's lived with a woman who's done that, right? We get emotional. We have symptoms of, well, when we start to lose and decline hormones, we have symptoms of multiple things that people just associate with getting older, which could be, right, fatigue is one of them, poor sleep, unexplained weight gain, harder to lose weight, brain fog, belly fat, anxiety, depression, lack of focus, walk into a room, forget why you walked into a room. Yes, libido, but some hormones can actually have been shown to improve insulin sensitivity and allow also certain nutrients to help with phase 2 detoxification. There's 3 phases, and that can help metabolize certain things. So insulin can be more not systematic, more sensitive, right?
Mm.
We're all aware of this insulin sensitivity or lack thereof, right? This resistance that we have. So as we're increasing and optimizing our hormones, it can have an improvement in insulin sensitivity.
So, which hormones help us improve insulin sensitivity, especially as women?
Well, testosterone is a huge a hormone that does multiple things. It can help with a majority of those symptoms I was talking about, can help with reducing inflammation, can help with insulin sensitivity. Thyroid is another that is a huge component on our metabolism and how we metabolize. Estradiol even has a little bit of a sensitivity in regards to being able to metabolize and has a supportive effect of our insulin.
Okay, that makes sense. Um, and so do you find that with the people that you're working with, that most of them are like, think about testosterone, are women, do they tend to be too low or too high? Or like, what are some of the balancing things that you have to work with?
Sure. So there's, nothing can be better than the what you put in your body, is kind of what you're able to absorb. Starts kind of with gut health. To be able to have an influence on what your body is able to produce naturally to balance your hormones. But as we age, we hit our peak in our 20s. And sadly, they used to say over the hill is 50, then it was 40. It's really 20 when you look at how we're able to optimize our health and longevity. So in our 20s, women can start declining with testosterone.
Hmm.
Most men will start declining testosterone in their 30s. And a lot of times, especially in females and women, we're not thinking of hormones until menopause, right?
Mhm.
Well, that's just estradiol. That's just estrogen that we lose at that time. So if we're able to know what is optimal for each individual and test testosterone, if you have some of those symptoms to see where you're at, um, supplementing some testosterone, of course, bioidentical, and we can get into that too if you want, but
Mhm.
can be beneficial. And I say can, may, might, because it depends on your situation.
Mhm.
Um, Most of the time, a lot of physicians, even, well, doctors and or just patients in general, are not thinking of hormones before menopause, and women can lose up to 50% of their testosterone by age 40.
Interesting.
Very
And so,
interesting.
if you're looking at like a postmenopausal woman, where a lot of people are when they start seeing symptoms of prediabetes and diabetes, what would be like a normal testosterone level?
Well, normal is where most consider what is within this lab reference range, right? The
Okay.
labs have this reference range that most will use the term normal. There is no normal, right? There is a reference range, expected
Mhm.
reference range, and there's optimal, in my opinion. So this expected lab reference range, it's expected to lose hormone as we age. So
Mm.
for a female that is maybe in her 50s and you pull, get your blood drawn, you do a lab test on testosterone, expected lab reference range starts with 0.
Mm. Interesting.
So 0 is normal. Okay, that's not optimal,
Right.
right? So
So what would you consider optimal? Because that's really what I think matters. Because it's true about so many lab tests that they're more like this is what's average, but it doesn't mean what's optimal. So, like, what do you think optimal testosterone levels would be for a woman that was postmenopausal?
Great question. So I'll reference Dr. Abraham Morgenthaler. He's a Harvard urologist. He's done tons of studies on testosterone. And back in 2016, he did an international consensus study where there was a bunch of international experts. They all came together and they did 9 resounding resolutions. And some of those included that there is no lab value that can determine where you feel and function your best, right? And there's no lab value that also can determine or does determine whether supplementation would or would not benefit you. So too many times physicians are so hooked at that number versus looking at the patient. How do
Mm-hmm.
you feel is the question we should be asking. And why it gets so confusing is because we're used to looking at a CPC or a CMP, right, on your red blood cell count, your liver function, and there's these levels, right, that are considered normal of functioning. Hormones are a different thing. They're a different ball game, right? You're your own best science experiment. How you feel and function is determined up to you. So when we're looking at what's optimal, well, where do we see symptom relief? Where do we see symptom benefit? So that could be across the board. It could be in a female, depending on your lab, it could be 80, it could be 150. It depends on maybe how toxic you are, how resistant your cells are. Because just like insulin resistance, there's cellular resistance to hormones too.
Mm-hmm.
So when you're looking at what's in the bloodstream, that volume isn't telling you what's actually in the cell,
Mm-hmm. Yes, I
right?
get that. Yeah. So
So
what
we're
can
really,
you
yeah,
do, to improve hormone balancing and as a maybe secondary even effect, improve our blood sugar levels? Like what are the tools or the supplements or signs and symptoms that people should be looking for to say, well, maybe I should check this. Maybe something's out of whack. How would we know?
when it comes to
That's two
hormones.
questions. Sorry about that. The first question is, how do we know if we should be checking for hormone levels and we might have some imbalance? Let's do that first question. The second one will be, how do we deal with it? But
Sure. So symptoms of hormones that could be not optimal, but
right.
still what some would say normal, right? I'm doing air quotes a lot. I'm realizing I'm talking with my hands.
Okay.
If you have symptoms that of fatigue, poor sleep, joint pain, increased weight gain, harder to lose weight, anxiety, depression, lack of focus, brain fog, lack of libido, thinning hair, thinner outer eyebrows, dry skin, brittle nails, constipation. All of those could be a sign that is telling you your hormones are not optimal. Now, which one? That's going deeper,
Mm-hmm.
right?
Okay.
Um,
That makes sense. So, but those are things that I think are important for people to understand to say, well, maybe I have noticed some of that. Maybe I need to go see someone who specializes in hormone balancing and see what they recommend, right?
Absolutely. I would say the other sign and symptom is say you have these symptoms and you go to a physician and they want to prescribe you a medication. Now, I'm not stating that a medication couldn't be right for you, but a couple of questions I would always ask your provider is, what is this doing for me? Will it cure what we're trying to do?
That's a good.
Yeah. How long should I be on this medication? And if I didn't take this medication, what else could I do to get the outcome we want or desire?
Mm-hmm.
And what side effects are with this medication? If you can ask those 5 questions, then that would maybe help determine if you should be taking this medication or not. Because a lot of times these medications are helping with the symptom, but they're not taking care of the problem.
Right.
Take it to analogies. I love analogies, right? So if you have in your house, which is simulating to your body, right? If you have a fire going in your home and smoke starts to right go up, your fire alarm is going to go off, right? So the fire alarm is stating, hey, there's a problem, right? There's symptoms that we're having. That's the symptoms.
Mm-hmm.
There's fire in the house, in your body, inflammation, whatever it might be, and the symptoms is the fire alarm. And taking a medication to just help with the symptom is like stating, well, just take the battery out of the fire alarm and it'll go off. It'll stop ringing in your ears, right? Well, that's not helping the fire that's still happening in your body or in the home, right? So if the medication can't cure that or assist with the problem, that's what we need to dive into and look into it, right? We need to spray water on the fire, not just take the battery out of the alarm.
I love that. I think that's a great metaphor and it's very clear. So, how do we spray water on this fire when we're having issues and it looks like our hormones aren't being balanced, we're having issues with our blood sugars? What would be the next step, or what are some things that you've seen be helpful in that situation?
Sure. So if it is a hormone suboptimal, right, or not optimal level, which typically general of them is going to be on the upper end of the scale of that expected reference range, is to look at possibly supplementing, right? This is, of course, we're looking at what are we eating, how are we managing sleep, water intake, exercise. That absolutely is needed and necessary. But when we're at a point in our life when we're doing that, and we do age, and especially in women, we only have so many eggs, and right, and when we're done, we go through menopause. And it should be called actually stop because there's no play button, right? We can't go back. So we're always in menopause. It's nothing you get through. You're just in it. So why would we supplement? In different ways you could supplement. Well, there's a couple different options, which are good. And there's a synthetic route, which are synthetic hormones, which those are the ones that the studies show and call, hormones cause breast cancer, hormones cause stroke, dementia, et cetera, et cetera. And that was typically from a Women's Health Initiative study back in 2002. And it was a flawed study. They were multiple different organizations contacted them saying, hey, if you actually read your study, it was flawed. They did an arm study and showed that's not actually what happened. It was because of a synthetic progestin. And it was 15 years later that they finally came back and said, oops, yeah, we're sorry. It was kind of really flawed. However, there was increased risk in breast cancer with that specific type of synthetic hormone. It was a synthetic progestin, right? The problem is that people say hormones cause cancer. And that's such a big umbrella name. The next question you have to ask is which hormone, right? And it's not estrogen, it's not progesterone, it's a synthetic progestin, right? It is similar to the body. It is not the same as the body. Similar to if you, Lord forbid, got in an accident and got cut or whatever, and you lost a lot of blood. Well, if you lost a certain amount of blood, you would need to supplement, right? Or have a blood transfusion. Well, if you're type O, I'm not going to give you AB blood, right? That would be bad. But it's blood. It's blood. If I give you blood, shouldn't that be the same? No, it's not. It's a different type of blood. So it's the same thing as, if you have a bioidentical, human identical, isomolecular, whatever you want to call it, it is the exact same hormone that's already in your body, right? There's no drug-drug interactions. There's no allergic reactions. If they're putting the same, not similar. So those are the two differences. And then how you choose to supplement either through, there's pills, creams, patches, injectables, or pellets, pros and cons to each. And that's something that, of course, you can decide what's going to be best for you.
So we're talking about the fact that what we call bioidentical hormones are actually better assimilated by the body, work better in the body than synthetic hormones, which are similar to the body, but not exactly the same. Is that what I'm hearing?
Exactly, exactly. So a synthetic is, it's almost like having the wrong key in your car. Back when cars took a key to start, right? So have you ever put, the wrong key in your house or the car, and it kind of fits, but of course it doesn't turn the car on or unlock the key, and then it kind of gets stuck and you freak out a little bit. You have to yank it out. It's like, we have those receptors on our cell, and the hormone synthetic comes in. It's not the same, but it sticks.
Hmm.
And it can relieve some symptoms, but now our body doesn't know how to metabolize it.
Hmm.
And we've got junk left over that can cause the side effects that we don't want.
Mhm.
Where a human identical or the same, right, not similar, is the exact right key for your car. So yes, it's going to fit into the receptors of the cell, but it's going to fit into the key for the car, turn on the car, right? And your body can use and unlock the benefits, use it, knows how to metabolize it and get rid of it, so you don't have those side effects, but you have actually secondary benefits. And what literature has shown these secondary benefits is actually five main areas, which is bone, brain, heart, breast, and even prostate protection. So when hormones are optimized correctly, we've actually seen reduction of Alzheimer's and dementia. We see reductions of heart disease, number one killer in America, right? We see reductions of breast cancer. Studies have shown 35 to 40% reduction of breast cancer and reoccurrence. We see reductions and even reversals of osteopenia and osteoporosis, which is a strong term to say and use. And then we've even seen reductions and or the severity of prostate cancer. So hormones are crucial to our organ systems, to top 10 killers in America that are preventable diseases, and of course, quality of life. How do we feel, right? We want to improve how we feel, not just live longer and live like crap longer.
Right? Yeah, so true, so true. So, are there any other tools or supplements besides bioidentical hormones, if needed, that you would suggest that people might think about in terms of improving their blood sugars?
Yeah, there's a couple nutraceuticals. Absolutely a proponent of that, because just what's in our food, the vitamins and minerals that are here today are just not what they used to be. As you take one bowl of spinach back in the 1930s, the iron content in that one bowl, to get that same amount, you'd have to eat 12 bowls of spinach today.
Wow.
So eating organic, if you have, if you're rotating the soil, which most farms are not anymore, it's cheaper to do, what they're doing now. That's why we're not getting the full benefits in our food unless you have your own organic garden out in the field. And then, of course, they're picking it before the ripening phase, putting on trucks to get into the grocery stores, which the majority of the vitamins and nutrients are in the ripening stage on the vine. So using your local farms, supporting them is a one key. So supplementation is super important. Now, where and how can you get that or get certain supplements? I would highly encourage you to look at a pharmaceutical grade type of nutraceutical, which you're going to get in a physician's office or online, which does not mean Amazon, because who knows what you're going to get on Amazon. It's not in Walgreens or Costco, as much as I love going to Costco, because it's not tested and it's not required to be. What they say in their products may not be. There might be more fillers, additives, colors. With the shelf life, it might not even be there anymore. I've seen some studies on omega-3s that there's more mercury and lead in it that you're taking versus the benefit that you're getting from actual omega-3.
That especially from fish sources?
Well, a fish source is one, right? One of many. So gut health, a healthy probiotic would be one of my top things that, of course, I take and my family takes, because you've got to help with the gut, right? All disease starts with inflammation, and inflammation starts in the gut. So to help with what good probiotics do is dive, like DIVE. It's going to help with digestion. So if you have more belching, bloating, burping, acid reflux. You probably don't have enough acid actually in your stomach, which most people think if I have acid reflux, I have too much acid. It's actually the opposite. It helps with your immune system to help bolster, serotonin, your other vitamins that you have in there. V is your vitamins. There's gut vitamins that you are producing in your gut when it's healthy. And then elimination, right? You've got to go. A lot of times I'll ask women if, are you constipated? And they'll say, no. And I say, change my question, say, do you go every day, if not multiple times a day? Like, oh no, like once every 3 days. I'm like, okay, that's definitely constipated. You've got to keep it moving, right? We have these finger-like villi, right, in our gut, and they're supposed to be tight. And when we eat, we release an enzyme that allows these to open up so the good proteins can go through, but the bad proteins and the gunk, right, the crap, we want to maintain moving on and eliminate. Well, when we have an inflamed gut, we don't start tight. We start here. And then when we eat, the enzymes are released, it opens up even further. So now not only good proteins go through, but the bad proteins go through too. And that's that term leaky gut, right? So you're absorbing the crap that you literally don't want and should be eliminating. And then that gets stored in your fat, that gets stored if you don't have enough nutrients to help with phase 2 detoxification to get that out so your body can do what it's meant to do. So probiotics would be another one. There is a newer plant enzyme that I've learned about. This is brand new and it is all plant source, a plant enzyme, but it's been shown to help transform glucose into more fiber. And it's been reducing, they've shown 50 to 90% reduction in blood sugar levels. This has been helping huge amounts with pre-diabetic, type 2 diabetics, and even the amount of insulin that a type 1 diabetic needs, which is absolutely wonderful and amazing. And then vitamin D is another big proponent of mine. It just helps with your immune system so much. It helps with moods. So many people worldwide are vitamin D deficient, and there's a big range when it comes to labs with vitamin D as well. So upper end of the range is where it's going to show healthy. And then your omega-3s, EPA and DHA, not just looking at fish oil, right? I don't know what fish oil is. I want EPA and DHA. I want omega-3s, right? Looking for something that's pharmaceutical grade online would be your best bet.
All righty. So what is your proprietary process to reduce symptoms of FLABB, and tell us what the acronym's for, and improve our quality of life?
Oh, I love it. Thank you for asking. So yes, reducing FLABB, F-L-A-B-B, stands for fatigue, low libido, anxiety, brain fog, and belly fat. And a proprietary process in that is one, doing an elimination diet. We have to lose. We want to lose belly fat. We want to lose the fatigue and the brain fog. But usually by doing that is figuring out what foods work for you. Because not all good food is good for everybody, right? You may have some food sensitivities, which is not to be confused with
allergies.
An allergy, thank you, yes. And you may not know that until you eliminate it and reintroduce it. So I do a 4-week coaching program just in regards to figuring out, okay, how do we do that elimination diet and still eat food? And then reintroducing that in a proper way to figure out what I call your magic plate it's going to look like, what's going to be best for you, because you're an individual and your food should be individualized as too. The next step is optimize. We need to optimize our hormones, right? I've started testosterone right before I was in my 40s. I've been on it for almost 11 years. The differences between specific hormones, right? Synthetic versus bioidentical, laboratories, which is right, what's optimal for you, different types of delivery methods, finding the right doctor to work with. So how do we optimize that? What does it mean to optimize our thyroid versus testosterone, progesterone, estrogen, or estradiol, certain nutraceuticals? So looking at optimization. And then transform. How do we transform all of that into what I call my 8 dimensions of wellness? So 8 dimensions of wellness is anything and everything you can think about. So it's emotional, it's mental, spiritual, it's occupational, it's of course physical, it's financial, it's environmental, and it's even social. So I take my patients and clients through what that looks like for them, the mindset around it, and figuring out what's going to be optimal for them so they can live that quality of life that they want to.
I love that. And I think that is something that is so needed today because not a lot of people know like where to go for this kind of support and this help. And I love that you've got a free gift for all of our listeners today. And that link is going to be right below this video in the description for the video. So you can go down there and check it out. But tell us a little bit more about what they will get when they click on that link.
Sure, just something so simple and absolutely free. So it's how to lose weight when nothing else is working. So of course we know diet yo-yos don't work, and it's the simple way of being basically why you're eating. Like who are you being when you're eating? It just kind of sounds silly, but I go over cephalic phase digestive response. And it's just a simple PDF to do a little test on what you're doing while you're eating. And one, I mean, everyone will get it anyway, not to give it away, but is timing just how you normally eat. And I initially thought, oh, I'd probably eat a meal, 15, 20 minutes, maybe. I ate my first meal in 3 minutes. Like I hooved that down like I didn't realize it, right? So it's becoming more aware. It's allowing, like I said, that cephalic phase digestive response and how that works and how it can work for you or as an individual, and just becoming more aware, which will help us digest better, absorb what we need to and what we don't better, and hopefully help with whatever that you're supporting your patients with and your clients with as well. So.
That's great. Well, I just want to say thank you so much, Julie, for sharing that with us. It gives us some really good food for thought and ideas of where we might go to improve our health. What are some of the areas we should all be thinking about? So I really appreciate that.
Absolutely. Oh, thank you so much for all that you do. You're amazing, everybody. We're so blessed to have you and what you're helping with a lot of patients. It's so needed. So I'm honored. Thank you.
Well, the feeling is mutual. And I want all of our listeners to remember that health is wealth and it comes by choice, not by chance. So hope you have a wonderful day.